Artificial disc replacement, which means you replace a damaged disc and you put in an artificial disc in order to minimize the risk of adjacent segment breakdown, meaning that the disc above or below, if you do a fusion, there's not added stress to it. So this concept has been around for over 10 years in the United States. In Europe, it's been around for a long time, but because of FDA issues, obviously we're not as robust as Europe, but I'm okay because we're more stringent and more careful in how we do things here. I have seen the tremendous success with the cervical spine, the neck, the artificial disc, and I started basically, I've been incorporating now tons of artificial replacement in the cervical spine, and the results have been spectacular. I mean, patients, I wish I could go back 12 years ago. The patients I did fusion, I wish I could offer them what I'm offering now with the artificial disc. But again, we did not really know the technology and the results that well. Now we've had over 7-year results, up to 10-year results, and we're seeing some phenomenon results with artificial disc in the neck. And what I've learned is that, okay, if it doesn't work, you haven't burned any bridges. You can always convert it into a fusion later. But I've also learned that you can actually even convert it to maybe a bigger artificial disc or a different size artificial disc, and that may work. So there are fantastic options which we were not able to offer 5 years ago to the patients. And this has been another great milestone that has been achieved to push and revolutionize the field of spine surgery.